Hello everyone, myself H B Sneha from College of Agriculture, Vijaypur. Today we discuss some of the important topics in livestock and poultry healthcare. The important topics are heat stress, heat shock and its first aids. First we discuss regarding the heat stress. Heat stress is the elevation of body temperature above normal due to defects in heat regulatory mechanisms against extreme environmental hyperthermia. Anytime the body temperature is higher than 106 degree Fahrenheit, a true emergency exists. The causes of the heat stress are animals kept outside on very summer afternoon, animals kept inside a ill ventilated stuffy room, overcrowding of animals, limited supply of water in hot weather, vigorous struggling during the handling of animals. And the signs are rapid open mouth breathing, protrusion of the tongue, frothy discharge from the mouth and nostrils, tachycardia, which means increase in the heart rate, temperature crosses 106 to 110 degree Fahrenheit, convulsions, coma and death. And the first aid that we take are shift to well ventilated area, provide fans, give cold water bath, if possible determine the rectal temperature and record. Begin to cool the body by wetting with cool water on the trunk and legs. It is helpful to use rubbing alcohol on the skin of the stomach and allow the fan to speed evaporation. Transport to veterinary faculty. And then comes to heat shock. Heat shock, it is a clinical state resulting from an inadequate supply of oxygen to the tissues or an inability of the tissues to properly use oxygen. The causes are trauma, poisoning, insect stings, fluid loss from vomiting and the diarrhea, infections, burns, and lack of oxygen caused by heart. Failure or obstruction of airways, that is pneumonia or the choking, are the examples. Regardless of the causes, shock is a life-threatening. Immediate identification is crucial. And the signs of heat shock. The shock we can identify in 3 stages, that is early stage, middle stage and the late stage. In early stage we can see a bright red gums, rapid heart rate, pulse not difficult to find. And in middle stage, gums appear pale or muddy. The heart rate is frequently above normal. The animal will most likely be subdued, depressed and weak. Rectal temperature often below normal. And in late stages of shock, gums appears extremely pale or show a bluish discoloration and are often blotchy in appearance. Heart rate is probably elevated and irregular but may be normal or below normal as the heart muscles begins to fail. The pulse will be very weak and difficult or impossible to locate. Respiration may be slow or rapid, shallow or deep. Mental condition deteriorates from depressions to stupor to coma. And the treatment or the first aid are providing advocate breathing, stopping blood losses, preventing loss of body heat by covering the patient with 1 or more blankets, immediately transporting the patient to a veterinary facility for definitive treatment of shock and other injuries and illnesses, protecting the obvious fractures from further injuries. Thank you.